Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How hemolytic anemia is different. Key takeaways. Hemolytic anemia happens when red blood cells are destroyed faster than they can be replaced. Sickle cell disease and thalassemia are inherited causes of hemolytic anemia. Treatment may include blood transfusions, medications, or surgery, depending on the cause. Hemolytic anemia is caused by the destruction of red blood cells faster than they can be replaced. This can lead to symptoms like fatigue, shortness of breath, and rapid heartbeats. Causes can be intrinsic, genetic disorders like sickle cell disease and thalassemia, or extrinsic, autoimmune diseases, infections, medications. Diagnosis involves blood tests and imaging. Treatment depends on the cause and may include blood transfusions, medications, or surgery. Left untreated, hemolytic anemia can lead to serious complications like heart and kidney problems. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.